before I start, our partnership with Habitat Ireland started in 2015. And with your support by sending us contribution to projects and Global Village team, we have served 2,720 individuals with the assistance that you have provided, which is around 40,000 US dollars already. Next slide, please. And what is the country? Again, for those that have visited, so it's a small country. It has 16 million people. It's still very rural, with 70% of its people living in rural areas and 30% only in urban areas. But for those that are living in urban areas, 55% of them are living in slums. You will also know here that the poverty rate as of 2015 is 13.5%. But right now, the estimate is that it's going to increase by 3% or 11% because of income losses due to pandemic. It is also categorized as a least developed country according to the World Bank. Can we move to the next, please? So how are we coping? I know Asians love masks, and I think in other countries like the US, it's very political. Mask is becoming a very political issue, but here it's not a political issue. So let's look at what is the impact of COVID-19 in Cambodia. Next slide, please. So you will see that the health impact of COVID-19 in Cambodia is very small compared to its neighboring countries. So there are, as of August 2, 240 reported cases, confirmed cases, 197 of them recovered. Fortunately, no death, and it has hit 13 provinces, including the capital. But what is really direly impacted in Cambodia is its economy. Three of its growth drivers, tourism, manufacturing, and construction, are on its knees. If you wonder what's happening to Siem Reap, where the Angkor Wat is, well, if you look at the combination of tourism, manufacturing, and construction, 70% of growth in the past 10 years came out of it, or even in the most recent fiscal year. And almost 40% of total paid employment came from those three sectors. So let's look at tourism. It's down by 99.5%. Angkor Wat, Angkor Wat is almost like a ghost town, or Siem Reap is almost like a ghost town. 3,000 tourism establishments have closed, which has impacted 45,000 workers. Factories, 150,000 factory workers were laid off because of closure of the factories. At first, it was due to disruption of the supply chain. But when Europe and US was impacted, the brand names where we were producing, the country that Cambodia was producing for Western brands, started canceling their orders. And the third sector is construction. All national investments for FY20 were postponed, except for those foreign direct investments. Next slide, please. So it is reported, according to the World Bank, that the growth rate of the Cambodian economy is going to slow down at its very lowest at 2.5%. That's a projection. But there are also some analysts that are saying that these projections are even probably rosy, because this was done around March, when it was still not very bad, when the situation was still globally, when the situation wasn't bad yet. So we move to the next. So what is it that we have done? We are lucky enough and fortunate that housing is in alignment with prevention approaches for COVID-19. So this house that you are seeing is actually the house of Charia, and we built this house way before the COVID-19 started. However, his husband lost his job. So now they are raising chickens and they are planting vegetables so that they could at least get some, some complementary income, or we don't have to buy any other goods because they already have it. But at least they have a place where they could stay at home when we were required, especially in March and April. Next slide, please. This house was built just in June. So we stopped working in the field for 2 months from March and April. So we worked from home for 2 months. We started digitalizing our operations. We moved to e-banking. We also started monitoring projects using Messenger on Facebook. And also we started doing homeowner build, where it's the homeowner who manages most of the construction. So this woman has already lost hope because she doesn't know when we will be back. But in May, when we started building, that was one of the very first houses that we built. And the only income earner from the family is a construction worker who works usually in the past every day for a month. Now he's only working 2 weeks a month. So when she saw that Habitat was implementing the hand washing, and we introduced face shields, and we introduced the disinfection using low-cost bleach solution with water because it's easy to find them in rural areas, she told her son, why don't you learn from them and tell your boss that you should also practice this, that you should also teach how to do the hand washing and how to do the disinfection and social distancing of 1.5 meters away from each other at least. Next slide, please. So let's talk about one of the skilled worker who's a major partner in the construction site. So Chai is one of my favorites. Chai is used to, he speaks a little English, and he used to be a migrant worker in Thailand 11 years ago. He could not make both ends meet, and he's always away from his family. So when he returned, he was introduced to Habitat, and he started working with us. So we suspended construction for 2 months, and we asked him, what did you do during those 2 months? They stayed at home, but they have to sell his wife's gold earrings and jewelry so that they could pay for a microfinance loan that they borrowed for the house that they built. So he did not get a house from Habitat, but he said because of the work that we do, that he does on a regular basis from 2010 up to now, he would have enough job within Habitat. But because of the suspension, he had to sell his wife's gold. And we were worried that the skilled workers will not follow all the PPEs and all of the requirements that we have in the new normal. We have a protocol for the new normal. But then they actually said, we have to follow because we're not even buying the thermal screens. They do the thermal screens every morning and every afternoon. We provide them with the shields, which is added into the helmet that he is wearing. And they also had to do the alcohol gels if there is, and also do the, what do you call this? They do disinfection of their tools. And we have also changed sweat equity. We have now, we do not require the home partner to work side by side with the skilled workers because the families we are serving, as you know, are already vulnerable even before COVID. So COVID, they are health compromised already because there are people living with AIDS, they are people living with disability, older persons, or even children. So we had to revise our sweat equity rules. And they can only work in the house that is being built at the time of when the skilled workers leave. Next slide, please. We also had to work very closely with village authorities. Our staff could not go to the field, and we have to train the home partners on COVID-19 prevention. So the blue tarp that you could see in the picture is actually how to prevent COVID-19. It's in Khmer, it's in the local language, and the home partner is being trained by the village authority on our behalf. And so it is important for us that we work very closely with local partners who already know the system. And I was so surprised when they say we were the only NGO that's working on COVID-19 in the site. And the banners that are hanging in the build site also make people look at them. So one of the things that we banned from the build site is to discourage people from visiting the build site. So the work of the home partner is to remind the skilled workers to do the PPEs, to use the PPE, social distancing, as well as to help us discourage visitors from spending time in the site. Next slide, please. So now let's move to what is it that we do. You have met some of our families. You have also met one of our skilled worker who used to be a migrant. And if I may just add, about 150,000 workers from Thailand, Cambodian workers, returned when before the borders closed. So that's a lot of people remigrating back to Cambodia. So one of the things that Habitat Ireland is supporting us is our urban programming, and it is linked to making cities and human settlements inclusive, safe, resilient, and sustainable. This is the 11th Social Development Goals of the United Nations. Now we move to the next, please. And how do we do this, and how does it relate to our work? So what we try to do is we do a lot of work with slums, with informal settlements, and one of the things that we do is to pilot land laws. Cambodian government has a lot of good laws that are not being implemented. So what we do is we try to pilot land laws that will allow people to climb the housing ladder. As you can see, the housing ladder in Cambodia is the middle one. I'm not sure whether Ireland is the far right or the far left. I don't know what is your what do you call this? I don't know what is your housing ladder, but definitely Cambodia is in the middle. And some of the things that we do in urban places is to work for security of tenure, work with slums. So let's look at what do we do specifically. So when we do, our urban strategy is to build resilient and inclusive urban communities. And one of those is Urban Resiliency Program, which I will discuss in depth in the next slide. So we want to create safe and secure urban settlements for the next 5 years. And it is more needed now because of the COVID-19. They are very dense and they are the poorest and they don't have basic services. Next slide, please. So this is the recent project that was supported by Habitat Ireland. The project is co-funded between Habitat Australia and Habitat Ireland. It's a 3-year project, and we wanted to increase the resiliency and security of 45 most at-risk informal settlements in Battambang City. Why Battambang City? Because it's a secondary city. It's easier to ask land from government rather than to ask it from the capital of Cambodia, which is Phnom Penh. So for this year, Habitat Ireland contributed $10,000 to Habitat Australia's $90,000. And what did we use it for? Next slide, please. With the additional $10,000, we were able to provide micro grants of about $2,000 to $2,500 to communities where they identify what is the cause of the risk and what is the resiliency they want to achieve, and with that they plan. Habitat does not do the development. They give them the money based on their community development plan, and they identify the priorities for that. Let's look at what are some of the priorities that they have done with it. So one is that, if you can see on the left-hand side, is one of the slums that was beside a hospital. So they are living on the road, and the left-hand side is before it was developed, and then on the right is after they have decided to improve the road. Now, in the past, when the rain comes, it was miserable for them as it gets so muddy, and it's difficult to travel on a motorbike. So after the community has decided that the road will be constructed, they don't have to make a detour, a muddy detour, to go to the schools or to go to the market. And they say that it saves them 5 to 10 minutes. So this is worth probably $2,500, but they also contributed about $300 to the improvement of the road. So that's one slum. And we have to work with government because the government has to agree that people can develop that land because it is not their land yet. Next slide, please. The next slide is about how to provide brighter walk lanes, safer for women and girls. You will see in the far right, when we were constructing them, some of their issues when they go home from school or from the market or from work, the lane is too dark and they feel so unsafe. So when the women were participating in the PASA or in the participatory approach for safe shelter, they suggested to put up street lights, but they didn't want to pay for electricity. No one will pay for the electricity, so they thought of a solar panel. So one of the things that they have, that the project has funded is to support the street lighting for the safety of women and girls, especially in this village or in this slums. So it has created a sense of security for the residents. Next slide, please. The other one is reducing mosquitoes, because most of the location of the slums in Banamang are sometimes along very what you call this, flooded canals, and there's a lot of plants and there's a lot of trees and a lot of water that is causing, it becomes a breeding ground for mosquitoes. So they have identified that the best way to deal with it is to develop a drainage so that the water will flow in covered pipes, and it will be a lot easier and cleaner for the families there. Next slide, please. The other one is reduce flooding because of waste separation. As you know, when you probably visited Cambodia, you see a lot of plastic and a lot of waste scattered all over the place. And in slums, sometimes it's very difficult for the truck to pick up their garbage because sometimes they have very narrow street, or even the government does not recognize it as a serviceable area. So in this case, what we have done is they identified that perhaps one of the things that they could do in addition to improving the road is to allocate a place where they could put their garbage and where the dogs could not reach into it and spread all the other things and will cause another messy location. So this has, in their view and in our view as well, has already reduced flooding as the waterways has been prevented from being blocked by the garbage, by the plastics or the other garbage that have been dumped. Next one, please. We also supported. I think this is probably the most expensive part of the project. The families asked for a higher budget because, as you can see on the left-hand side, the canal is full of plastic, and the houses are built either on top of it or close to it. So what they have done is to dredge it, make the canal bigger, and to remove all of the garbage. In addition to them educating themselves about how to dispose their garbage properly. Next one, please. But I think the best part of the project is not so much about those infrastructure. It's about, for us, resiliency is about the ability of people to participate together, to identify what the problems are, to argue about priorities, to argue about solutions, and how to make $2,500 or $2,000 or $1,500 fit with the solution of the problem that they are identifying. For us, this is the most important part of resiliency, when they learn how to negotiate among themselves And also when they learn how to present their plans to government, because the government will have to agree that their plans can be implemented because they are living on government land or on land that is not theirs. So for us, this is the most important part of resiliency in slums. Next slide, please. Here is an example of the walkway where the community are every day they are walking across that walkway and it's so dirty. So that is one of the things that they have cleaned up and they have drenched. And you can see it's a combination of women and men that's working on it. And they are quite proud of themselves because they never thought that their village or their settlement could be cleaner. They never thought that the bad smell could actually flow away when it rains. That it's just being caused by the poor attitude of people just dumping anywhere, and also not maintaining the size of the canal or the depth of the canal. Next slide, please. Again, from 2017 to 2019, we had 6 teams from Ireland with 84 volunteers. Thank you very much for coming. You have built 8 houses with a donation of approximately 42. I think this is the most updated one, which is 42,000 US dollars. I don't know if some of you are in on the call. And this is, you have supported 3 projects. The oldest project is a rural housing and a water restoration project. The second one is Empowered Community for Urban Reintegration. This is again an urban resiliency project. And the third one is our biggest project in Baramang, which is the urban resiliency, where I shared with you some of the good things that have come out of the project. As you can see, Jenny keeps saying it's very small, but if you look at it, 10,000 spread over 4 communities, and how many people have been served by that, and how many people have been encouraged to actually work and plan something that they could do to improve the resiliency of their settlements. Next slide, please. What are our future plans? So with COVID-19, we want to prioritize work with slums. As you can see, you are probably wondering why is it that COVID-19 is quite low. The infection rate in Cambodia is very low. Well, we are not highly urbanized. We don't have mass public transport system. We don't have high rises. We don't have malls. But we have a lot of slums where the density is very high, where it's very poor, it's overcrowded, and as you can see, they lack infrastructure, especially on water and sanitation, with very small or none open spaces. So what we would like to do is to start investing in these communities. We will probably come back to these communities and introduce mobile hand washing stations or introduce toilets where there are communal toilets. We could probably build more toilets. We also would like to work with the informal sectors, the people that are working, those that could not afford to stay home because they have to work every single day. They are irregular income earners. They are older people. So what we would like to do is to start working with governments and try to advocate for them to first stop eviction. Do not evict them because where will they go? Second is to identify what else could be done if COVID-19 hits Baramang or hits informal settlements. What can we do? Are we going to do container housing so that they could have a place where they could do quarantine, or are we going to schools where the government is developing them into temporary quarantine areas? The other one is to work with the city, not just working with the community and not just advocating, but also to work with the city and ask them what is it that they will do to be prepared for this. For example, now the government is spending $25 million a month. They are giving $30 for those that are very vulnerable. Every month they're going to give $30 per month as a subsidy Imagine $30 per month. And the price, the subsidy that is being given to urban areas is higher, or to the cities is higher than the rural areas. So if the city is just going to keep giving money, but they are not prepared enough to do it, we need to be able to influence them to think, how can they improve service delivery? How can they work with the private sector? How can they budget for this crisis? They have borrowed a lot of money from ADB and the World Bank to be able to respond to this. So we are also thinking maybe we could do some drills, and we can ask them what is their deployment plan if something worse happens to Cambodia. The other plans that we are doing is because the families are receiving money from government, I know $30 is not enough. It's very small. So what we would like to do is to assist them in finance planning. So what is it? Would they buy seeds? Would they buy chicken so that they could make the money go further? Or would they like to learn how to negotiate with their current lenders about the loan that they have? Do they know how to negotiate for a restructuring of the loans? Maybe they do not. We don't want them to lose their land or the house. So one of the things that we want to teach them is how to know what their rights are with lending. The other one is, I have mentioned this already, is to probably introduce, we would like to have hand washing stations in community markets, in mosques and temples where people usually congregate. So this would be on wheels, and we have seen a lot of models and we want to try some of them. There are also some families from the rural areas who cannot go to school because because the schools are closed. And they are now being asked to do online studies. But how can they do that? There's no electricity, or if they have electricity, they don't have computers. So some of the schools have requested, do you have second-hand computers that you're not using in the office? Can you share it with us so that at least we could use it for some of the schools? The other one is also, we want to look into how is this quarantine and this pandemic impacting women and girls in domestic violence, because now that they're staying home, it has been reported that probably there is an increase. So we're looking at it this first quarter. So those are some of the plans that we are doing. Can we move to the next slide, please? These are your photos of the bill. I hope it reminds people when you were here, the different types of work. As you can see, I would like to point out that as part of our market recovery approach, we always believe that the construction should be highly manual so that it gives jobs to people. It uses local resources. We are also using a lot of skills, small village level kind of skilled workers, so that the money goes in and they buy their food in the local market. Even our suppliers are encouraging our home partners to just don't buy them in the city, just buy them where they are, even if it's a bit more expensive. So that's our little contribution to market recovery. Next slide, please. Oops, that's it. Right. All right. I think I was trying to do it for 30 minutes because I was wondering if you have questions for me, or if you also want to share how Ireland is coping with the pandemic.
First of all, I'd like to thank you, Bernadette, and that was just such a wonderful overview. I would like to take time for questions in case there are any, and I would like to ask you, if you have questions, can you type them in the Q&A? So if you can type them in the box, that would be wonderful. And I have had a couple of questions in advance. And one question was, are there specific things, Bernadette, that we in Ireland could be paying for in terms of Habitat Cambodia? So that was, someone sent me that in advance.
Right. Oh, thank you very much for asking us. We have been supplying our skilled workers and the communities where we work in with thermal screens. We were thinking of just giving them the normal thermometers that you put under your armpit or you put in your mouth, which is not very sanitary. So we are stockpiling because especially in the urban informal settlements where it is very dense, we would like to be able to provide the communities with those things. We also are teaching families how to do what they call this reusable fabric masks. And so we have to either teach them how to make them hand sewn, or we have to provide them with sample kits so that they can just make them. We also are teaching them how to do hand washing properly. We have been focusing in schools, and now we have to go back to our informal settlements, the mature ones. We would like to introduce hand washing stations in them, so that they could at least access soap and hand washing station, especially at the entrance of the informal settlements. It's quite difficult to find what do you call this, the alcohol. So we're looking at other ways of disinfecting, and we think that hand washing is very important compared to having alcohols. If we cannot find them, it's very expensive. It's also difficult. And we also want to print in Khmer the different guidance on how they can wash hands, on how they can prevent the spread. There is even a training where you put your hand across, and the way you will know whether the person is 1.5 meters away from you is if the face of the person is right inside the circle. So simple skills that we have to train, and we have to train community health workers just to be able to remind them what are the best or effective ways of preventing what do you call this? Preventing the transmission of COVID-19. The other thing that we have changed so much is we have negotiated with some donors, instead of building a house, for example, one project, last month we were supposed to build a house. And we said, well, in that village, there are only 2 toilets and there are 50 families. Can we convert them into toilets so that at least more families will be able to access? We can add a hand washing station in there. So instead of just one family being assisted, we could assist the entire village.
Thank you.
Could make it better.
Thank you. And that reminded me that Bernadette and I spoke a couple of weeks ago, and we committed to help support some of the costs of the PPE that's required for the skilled workers, which brings me to another question which is typed to Bernadette.
Yes.
From Barbara, and Barbara was in Cambodia, I think 3 years ago, anyway, something like that. And Barbara's asking about the skilled workers and how many people are still able then to be employed. And you mentioned the number of homes that you'd built. I think you said 57 since lockdown. Thank you.
That's right. So for this year, we are aiming to build 257 homes. And we are building in 7 provinces. We have a contract with 28 skilled workers like Chai. So Chai is the lead of his team, and he has 4 people under him. So every month they build a house. I think before COVID, they build a house for 7 days, like the house that you have built, Barbara. But now with COVID-19 and with some of the things that we are doing, it's extending it to probably 8 to 9 days. So they can still build 3 homes a month. And we were able to finish 48 homes from May to end of June. We asked the skilled workers, are you able to do this? And they said, well, can you give us 58 instead of 48? So we have a lot of skilled workers, and the way we keep them is we have a 1-year contract which is renewable every year. So that's the reason why Chai has decided to stay in Cambodia instead to go overseas, because they already have a contract, and every time they finish a house, then we just give them a house. We are lucky enough that we have a multi-year programs that supports us in building homes, and we can project how many houses to build. So it's good to know, Barbara, that you are keen to understand more about our skilled workers. They are our greatest partner as well.
Thank you.
And I was wondering during the COVID, and I was saying, can we also pay them even if they are not working? You know, my heart just goes out to them. How are they dealing with this? So right now they are cooperating with us with all of this COVID-19 protocols in the new normal, because they don't want to stop working. Thank you.
Thank you so much. Just one final call then for any other questions. We're just almost coming to the end of our time together. So if there are any other questions, please type them now in the screen.
Or I'd love to hear their voices as well, if they want to.
I'm not sure that we can do that.
Oh, I see. Okay, all right.
It's possible in a meeting, but not in a webinar.
I see, all right.
So
Okay.
it's a different yes, I didn't know that until we started to do webinars. So
Okay.
it's just a different format. So, but please, if you would like, any of you would like to share anything with Bernadette, please type it, because I know I've really appreciated your time. So any other comments, if it's not a question? So can you read that? Biggest single challenge? Can you read that, Bernadette? So John is asking, and actually John is representing the school which made the big donation, which is wonderful.
Oh,
John
right.
hasn't yet been able to travel to Cambodia, but was supposed to be there in June. So he's asking, what's the biggest singular challenge?
What is the singular biggest challenge? At the moment is it is jobs for most people. It is how we can survive the economic challenges of COVID, as Cambodia is very dependent with the global economy. So that's for its jobs. We even have to we have 62 staff, and in the past month, 2 weeks, we just had a restructuring which saw 6 of our staff leaving us, and also about 10 of them, 10 of them with reduced hours. So that's the biggest challenge that we have. How can we help communities survive the economic impact of COVID? Our home partners, our communities as a whole. Because even the government, as you can see, they're only helping with $30 a month. And when the communities come, they say, so what will I do with this? So we said, well, do you need any help in helping identify how can you make it go further? So that's, I think, John, thank you very much for your question. The biggest challenge is really how to help them survive the economic challenge. And probably the second one is the mental health challenge. There's a lot of depressions around it. There's a lot of frustrations and disappointments. And I don't know if there's enough mechanism to be able to even hope people say that I am mentally challenged or I am mentally impacted by this. I hope I answered your question, John.
Thank you, Bernadette. And it's interesting because there you go. That's lovely, Barbara.
Right. Thank you so much, Bernadette. I was in Siem Reap in 2017 and Battambang in 2018. my body left, but much of my heart stayed. It's good to hear of the amazing work that you're continuing to do despite the problems. Yes, we are emboldened by the continued support. It was a breath of fresh air when Habitat Ireland posted those photos on Facebook. At the time when we already anticipated there will be no GVM until September 2021, and there will be no unrestricted money until end of July 2021. So when we saw that, we were so, one of the staff actually jumped and said, Bernadette, did you see that? Did you see that? And I said, yes, we saw that. So thank you very much. It is like a, what do you call it? It's rain in the middle of summer. It was, thank you very much.
I'm laughing a little bit, Bernadette, because in Cambodia, I imagine you do what? Rain in the middle of summer, whereas we do not.
Right.
But it's interesting that you highlight the mental health impact of COVID, because obviously that's something that we share. And I suppose the thing that I've always felt whenever I've had the privilege to travel with Habitat and see many of our programs on the ground, I think not about the things that are different, but about how much we have in common and how important a home is in order to be able to build a better life. So I'd just like to thank you, Bernadette, for giving up the time. I'd like to thank all of you who have joined the webinar. It's been a real pleasure and a privilege to hear directly from you, Bernadette, and I wish you blessings for all of your work, and we look forward to being an effective partner over the long term. So thank you so much.
Thank you very much as well for taking the time, your precious time, to listen to this, listen to what I had to share and what I shared. I am very grateful that you continue to be interested despite the fact that we can't really do much with the situation that we have. I appreciate the partnership. I appreciate your presence today. Thank you very much, Jenny and team, and Barbara and John. Please let your school know that we will share with you that the families that will be assisted by the money that you have shared with us and the support that you have given us. Thank you very much.
Thank you.
Goes a long way. Thank you.
Thank you. Take care. Thank you all.